How is it that we find ourselves surrounded by such complexity, such elegance?
The genes of you and me, the genes of you and me, we're all made of DNA. We're all made of the same chemical DNA. We're all made of DNA. We're all made of the same.
Hello, you're listening to DNA Today, a genetics podcast and radio show. I'm your host, Kira Deneen. DNA Today informs on what's happening in the genetic world. During my broadcast, I educate you, the public, on genetic and health topics through event coverage, news stories, book movie reviews, and interviews. Guests include genetic counselors, researchers, patient advocates, and professors. Joining me on this episode is Eden Lord. She's a co-founder and CEO of City Med. This is an online health and medical resource site that allows patients to search for a doctor and read reviews about that doctor. It also connects nonprofit resources and online community support groups. Eden Lord is also an advocate pursuing legislation to advance rare disease research, so we have a lot to talk about on this episode. Thanks so much for joining me.
Thanks for having me.
So I want to start getting into why you wanted to start City Med, and then we can kind of go from there.
My City Med really was created from necessity. I have a daughter who suffers from a rare disease, and for us, it was a challenge to coordinate care with our doctors locally and to know that she was getting the absolute best care possible. So it was really kind of an ask to search for those best doctors nationwide and find doctors who had experience with her specific diagnosis. So we really just kind of wanted to plug the holes for patients and create roadmaps. So when you do receive a diagnosis, you know where to go locally and who the best doctors are and resources and providers for you in whatever diagnosis that you're trying to manage.
So this has really helped, particularly in your family, and you're kind of like, hey, this works for us. It can work for other people.
Exactly.
So take us through kind of how this website works once patients log on and what features you guys offer that they can take advantage of.
When patients log on, our primary goal was to allow them to be able to search by their specific diagnosis, or they could search by city, where they're located, to see what the resources are, or they can search by specialty group. So it was really just kind of a question of making it user-friendly and providing them roadmaps. We're in the process of creating roadmaps that cover everything from diagnostic testing, what to expect when you're diagnosed, symptoms, and then all those ancillary kind of services that you think of that come into play, especially if you've got a condition like diabetes. You think about diet, exercise. Where do you find those local resources? Where can you find a gym or a physical therapist or that kind of health provider that has experience in your field? We just really wanted to bring all of those different resources together in a single spot and let users go in and search how they feel comfortable, whether that be by the diagnosis or by the geographical area.
So not only are you linking them with whatever's local to them, but say there's a specialist that's, a few states over or something, you're able to highlight that for them as well.
Absolutely. We want to bring the best options to them and then obviously let them see what their insurance or their provider covers or what they're willing to do as far as travel to get to that provider. But at least they know where that person is, even if it's just for a consult.
Because it can be pretty challenging to just, go onto Google and try and figure out these things because you're sifting through so much other material that may not apply to you, or it's too far, or maybe it's not the best doctor. So you guys kind of really help narrow down where patients should be looking.
We do, and we rely a lot on our nonprofit network of organizations that will come through and help us vet the information. And it obviously everything goes through their scientific advisory boards, and they are gracious enough to credit them or let us credit them and show that information on our site and use that information on our roadmaps, and then help us verify that the doctors we've identified for a specific condition or specific treatment are really the best in their industry or their field.
So it's really a team of people that are looking at all this information before it ends up being put on the website for patients to be able to consume.
Absolutely. We vet everything and then we go back and vet it again because we don't want to mislead somebody down an incorrect path. Our goal is just to put the resources out there and let people make decisions and choices for themselves.
And part of this is reviews as well, right? So if patients are logging on and they're looking at a specific doctor, they can see reviews about that doctor. Is this reviews from patients? Is it reviews from maybe fellow doctors? How does that work?
We do have user reviews that go out there And one of the things that we do that makes us different from Facebook or Yelp or any of the other social media accounts is when our users sign up, they have the option to sign up anonymously. So we will track IP addresses and prevent trolling or repeated negative reviews where they might not be quite accurate. And we do give doctors the ability to respond to reviews as long as they remain HIPAA compliant. Obviously, our users' patient privacy is of the utmost concern for us, but they are able to go out there and respond to those reviews and kind of have a rebuttal if there's an issue. But honestly, it's a lot of people who have been out there, they've seen these physicians, they love the treatment or they love the care that they get from that doctor, and they just want to share it with other people.
Which is awesome to be able to do if you really have a positive experience, to say, hey, like, this doctor really knew a lot about my specific disorder or disease, or they were really able to look it up if they didn't know it. And
Absolutely.
I think it's so cool that you're able to also have users be anonymous, because, this is kind of healthcare information. You don't necessarily want to be posting on social media exactly what you have, and for a lot of different reasons. Insurance is probably a big one. But that's very cool also that you have doctors being able to look at this. So you're obviously focused on patients and that's your priority, but to be able to include doctors in the narrative is kind of a different twist that I haven't seen with similar things or other online conversations.
We definitely want to get into a place where doctors are more involved. I think there is a general consensus that social media is going to play a larger role in healthcare going forward when you're selecting your doctor. One of the things we're excited about is in the next few months, we'll be introducing doctor videos. So the doctors will be able to upload a video on their specific profile page, allowing patients to really meet them before they go in for that first visit to meet them. And that actually increases the likelihood that a patient will keep that first appointment and any follow-up appointments, because it reduces the anxiety from not knowing what the office looks like, what the doctor's bedside manner is, or any kind of, those concerns that you have prior to going in. So we're excited for what that's going to hold in the future too.
That's really cool, because being able to already kind of meet them before you actually go in person does really give you a sense of like what kind of person they are. Like, are they, very strict, or are they a little bit more laid back? Are they very patient oriented? So I like that. That's really cool.
We're excited about it.
So how do you get this listing information initially? You kind of talked about the review process on, getting this information in there, but where does it first come from?
We actually have kind of three main sources that we receive information from. First, we use the NPI registry to verify all of our data and all of our uploads. And that is a national public database that's out there, sponsored by, I believe, HHS and Centers for Medicare and Medicaid provide these files that are out there for public use. So for us, that's one way that we do it. We verify those files and update everything monthly. Doctors can also go out and add themselves and claim their own listing and put their information out there, or verify what we've already put out there for them. And then we get patient recommendations all the time. We get emails all the time. I received one yesterday from a man in Texas who's battling mesothelioma, and he said, I just wanted to let you know about this fantastic doctor at MD Anderson. Here's the information. So for us, it's really exciting when we get those kinds of emails and users want to share those resources with us.
Which is pretty cool. You've talked about a couple different cities. How many cities are actually included in your database? How far is this reach?
Right now, we are in 50 major cities across the U.S.
Wow, 50.
Yes.
That's a big number already.
Well, it's not every provider in every city just yet, but we're working on it. We're actually excited. We'll be rolling out at the end of next month a new website that will have city guides for each of these 50 cities. I believe we've got like Atlanta, Denver, St. Louis, Kansas City, LA, Houston, New York, Boston. And so you'll be able to see, just kind of from a general standpoint, here are the best pediatricians, here are the best general practitioners. So if you're not necessarily disease specific, but maybe you're moving and looking for a new physician, those city pages would be very beneficial to you. And then overall, with the number of providers, we should have about 2 million by the end of next month.
Wow. So you guys are definitely moving along with everything. One thing that you mentioned was kind of just all the different aspects that My City Med offers patients specifically. The main thing being providing a roadmap to be able to find, either in their local city or nearby, doctors to be able to see what other ways can they benefit from this service. how do you kind of set them up with maybe other patients to connect with?
We have a social network similar to what you would see on like a Facebook or something like that. I kind of like to say that we're Yelp meets Craigslist meets Facebook,
Nice.
all in a single spot. And that allows our patients to really kind of identify other patients who might have their diagnosis. Again, we're anonymous, so we do track the IP addresses to make sure everybody's safe and secure, and we do have monitors. One of the things with our reviews and with our discussion posts is we don't use filters. And other review sites like Yelp might use an algorithm to weed out comments in that social network that would be flagged or things of that nature. We don't do that. It would certainly be cheaper to do it that way, but we have actual moderators and people who go out and read those discussion threads. They go out and read the comments. They go out and check the flags that might be set by somebody else in the user community. So all of our users have that ability to flag a comment and say, nah, maybe this doesn't belong here. And then all of our reviews are hand checked the same way.
Wow. So you definitely have a lot of hands-on action on the website and engagement and everything. For patients on discussion boards, are there specific discussion boards for different diseases and disorders, or is it more of a larger community?
We are definitely supportive of the general threads that you'll go out and see. The information like on diabetes. There's a lot of information out there as far as different diets that might benefit kidney patients. So one of the things that we're excited about is we take all the information that would typically be siloed on a social media site with the private groups, and we're making it public. We're making it available. So regardless of what your diagnosis might be, there might be a treatment that would benefit you, even though you don't have that specific diagnosis. There could be a diet that would work for you. There could be an exercise plan that would work for you. So we're excited to get those general pages up and going, but we definitely have the disease-specific groups as well. And then our nonprofit groups who sign up and claim their listing have the ability to run their own private kind of discussion forums and threads. So if it's anything specific that they want to kind of lock down a little bit, they're able to do that as well.
And with that, when patients connect online, have you seen any patients kind of take it a step further and then connect in person with different, events, raising awareness or raising money? Have you seen that?
We have seen some of that. We've actually been invited, and we haven't been able to go just yet to a couple of different meetups because we are nationwide. It's hard to get out of the Midwest to go up to Seattle for a day to witness a meetup or things of that nature. But it's exciting when we do hear about that. We do try to support our nonprofit partners who join our network by adding donate buttons to their listings, and that takes a user directly back to that nonprofit site. We don't take a cut. We don't get a percentage. We just kind of deposit them right back at the source and say, if this was valuable and you benefited, consider making a donation to this organization.
That's awesome, just to be able to promote so many different types, since your network is very built for all kinds of patients, to kind of channel patients from there.
Absolutely, and try to raise awareness for the awesome things that these nonprofits are doing.
Now, switching gears a little bit, we've been talking about patients a lot, but focusing on physicians. How can physicians benefit from the service? We mentioned them being able to soon post videos, kind of a meet me video, and respond to comments. Are there other ways that they can get involved?
When they go out and claim their listing, we actually, that's how we're funding our site, is we've got a free basic listing that is available to every physician, or if they want to purchase their listing for a nominal fee, because honestly, doctors have student loans too. We
Yes.
try to keep it fair for everybody. They're able to go out there and add more information. So if that would be a publication that they've written, a partnership that they've forged with a nonprofit organization, or any fundraising activities that they've participated in, any research findings, discoveries, the videos, as we mentioned, additional pictures of their practices. If they've got clinics coming up or events, that's another thing that we do that we're super excited about, is our event calendar. So nonprofit organizations and physicians are able to go out and say, this is happening in your city this weekend. There's a health fair, and we'll be giving free vision screenings or things of that nature. That really allows them to kind of go out there and introduce themselves a little bit more to their community.
So my City Med is really for everybody, patients, physicians, that they can benefit from and definitely get involved, as you guys are just growing so much.
Absolutely.
So you're involved in the rare disease community. You're a parent of kids with rare diseases. did you want to share a little bit about your kids and raise a little awareness for the diseases they have?
Absolutely. I never turn down that option ever. When you get that invite, you take it. My daughter has a chromosome disorder, or a chromosome deletion, actually, that I had passed along to all three of our kids. So our oldest didn't have any manifestation of that deletion. My husband actually passed along an extra half a chromosome of his own. And the NIH kind of looked at us a little funny when they mapped all of us out and went, we've not seen this very frequently. In my middle kiddo, it has manifested in a condition called panhypopituitarism with secondary adrenal insufficiency. So for her, that means replacing all of her hormones every day, human growth injections every night. So several pills a day, and really trying to just manage all of that her condition entails, because there's so many different body functions and systems that rely on your hormones for stability of your blood pressure and your blood sugar and things like that. So for us, it's really been putting together the right team of people to help us manage all of those different body functions and systems, and really making sure she's got the best care available. And then in my younger son, it's manifested in some orthopedic issues that we're addressing. So it's been a godsend to be able to search our own database and find the best physicians and doctors to treat our kids.
And I definitely have to thank you for just being, so active in the rare disease community and being a caregiver. From, talking to people in your position, it's definitely a more than full-time job. And, I just want to thank you on behalf of the community for really being able to be such an advocate.
Thank you for raising awareness with your podcast.
Yeah, no, definitely. So one of the things that you're involved with is legislation in terms of kind of benefiting the rare disease community. I've been to a couple events that are, that certain parents and caregivers and are looking to get something passed in order to really benefit the community. Is there anything that you're currently involved in, or that you've been reading about, that you'd really like to see in terms of a legislation change?
We have been active in pushing for an emergency database, a national emergency treatment database that would allow rare and chronic patients to upload protocols. So think of like your organ donation registry. When you go to the driver's license bureau, you sign up and you say, yes, I will be an organ donor. This would register rare patients and chronically ill patients in the same way, but it would provide protocols and specific medical details that could be accessed by EMS in the field. Oftentimes, you would see an emergency system kind of go into place at your local ER. This would allow patients to have treatment nationwide, regardless of where they are, by scanning, an access code, a QR code, or something of that nature that would self-identify. So EMS on the spot would know how to treat you. And if you had an emergent condition that couldn't wait until the ER, you would receive that treatment in the field, and you would reduce medical errors overall. So we're excited about seeing some kind of foothold take place in the future with that kind of a database to honestly just save lives and get people the treatments that they need.
And this is something that you're not just dreaming of, you're actively working on. This is a project that you have really been transforming.
We do. We have a website called MobiMedQR.com. And basically, out of desperation, we created QR codes with my daughter's picture. So there's a photo ID, and we literally have waterproof stickers on the inside windshields of our vehicles. My husband and I both. Actually, my mom actually has one too on her windshield that would allow people, God forbid we were in a car accident, to identify my daughter, make sure they had the right patient, and would let them know that she's got medication that needs to be injected immediately and is available right there. So we are seeing a lot of adoption of this. People like it. They like that there is facial recognition and ID. They like that they're able to upload crucial details. And we even go so far as, if there is an injection or a medication that needs to be used in a specific way, we provide YouTube video links on each individual patient's page so they can see how that medication needs to be administered.
So this is just kind of blows my mind. Like, that's amazing to be able to have that much information, and all they need to do to access this is just scan the QR code, and that responder can immediately see this full profile and have all of that information before they are, responding to the accident or whatever it is they've come to the scene for.
Absolutely. And we do the scan, and then we do a two-factor authentication. So they are then sent a code that they quickly input, because we want to make sure we've got patient privacies locked down and that not just anybody could randomly scan a QR code for no reason. We also have a 24-hour call center. So if they're unable to scan that QR, they can still get the information they need.
Wow. I definitely can see this becoming a standard in terms of not just within, the rare disease community and others, but just for anyone. Because, we all have something going on that usually we're telling our doctors about or something. So that's a really, really cool project you have going on. And so people can go to MobiMedQR.com in order to learn more about this and maybe even get it for their own child.
We're excited about it. We really want to help people feel more empowered. And honestly, at the end of the day, we just want to help save lives.
Which is awesome. Well, I did want to ask one more question before we wrap up the show, and that's if you have advice for other caregivers of people that have rare diseases or those that are looking to kind of become more involved in the community.
Oh, wow. Three-pronged.
Yes.
For caregivers, honestly, accept the help when it's offered. And that's so hard for us to do because as caregivers, we're kind of control freaks and very type A personalities, and we don't think anyone can do it as well as we can. And there are certain times you need to step back and embrace the help when it comes. For rare disease patients, absolutely don't stop questioning. If you're not content with an answer and your gut is telling you there's something more going on, your gut is right. It's a question of finding the physician that will listen to you and say, yes, I understand where you're coming from. You're the patient. You're the one living this. I'm willing to listen. And when you find those physicians, don't let them go. Don't let them retire. Keep them nearby and keep them close. And, honestly, for those looking to be involved in the rare community, there are so many great organizations out there that are looking for volunteers, looking for speakers to share their own personal experiences. Go out and search for what's meaningful to you, and I guarantee you'll find an organization that's willing to support any volunteer work that you want to do.
Definitely. And for those listening in Connecticut, the National Organizations for Rare Disorders have headquarters right in Danbury, Connecticut. So that no excuse. You can head on down there. And so they're a great organization. I've worked with them before. But that about wraps up today's episode of DNA Today. I want to thank you so much, Eden, for coming on the show and sharing about My City Med and being a mom of kids with rare diseases. It's definitely hard to do, and I really appreciate you kind of sharing your wisdom on today's show.
Thank you so much for having me.
And if you want to check them out online, you can go to @MyCityMed on both Twitter and Facebook. It's the same thing. And also the website, mycitymed.com. So pretty easy to remember there. If you're looking for more information about today's show or any of my previous episodes, you can go to dnapodcast.com. I'm on Twitter @DNAPodcast, Instagram @DNARadio. One's a little different. And for those wanting to learn more or have a question for one of us, you can email in at info@dnapodcast.com. Any questions for Eden, I'll forward on to her. I also wanted to let you guys know that it's Rare Disease Month, which leads up to Rare Disease Day on the last day of February. So this year it is February 28th, 2018. The theme for Rare Disease Day 2018 is research and the important role that patients and their families play in advancing rare disease research. There are 2 events in Connecticut that I want to share and encourage you to attend. I'm planning on doing so myself. The first event is at Quinnipiac University on the North Haven campus, and this takes place on February 27th, so the day before the official Rare Disease Day. And so February 27th kicks off at noon, goes till 4, and it's going to have lots of speakers and a patient panel, so lots of stuff happening there. The next day on official Rare Disease Day is on February 28th. In Hartford, there's going to be another event that is a breakfast from 8:30 a.m. to 11 a.m., and this takes place at the Legislative Office Building in Hartford, Connecticut. That's 300 Capitol Avenue. And again, that's going to be 8:30 in the morning. So hope you guys can attend and celebrate Rare Disease Day and throughout the month and learn a little bit about different rare diseases with hopefully the angle of research. Again, the 2 events, Quinnipiac's on the North Haven campus, is on February 27th at noon. And the second event is in Hartford, February 28th at 8:30 in the Legislative Office Building. Hope to see you guys there. So thanks for listening, and join me next week to learn and discover new advances in the world of genetics.
How is it that we find ourselves surrounded by such complexity, such elegance?
The genes of you and me, genes of you and me, are all made of DNA. We're all made of the same chemical DNA.